please confirm your name is correctly displayed on the participant icon. That would be super helpful. We want to ensure we capture all participants' names correctly. And as a reminder, for transparency purposes, this meeting is in webinar format, and all comments made either verbally or typed into the chat are considered public record. And to ensure all voices are heard, any comments placed into the chat will be read aloud. And in addition, this webinar is being simultaneously interpreted into Spanish, so there may be pauses during the meeting to allow for interpretation to take place. So before we get started, let's start the meeting by finding out who is all on the call by doing a quick round of introductions. So if you wouldn't mind raising your hand using the raise hand function, and when your name is called, unmute your microphone and provide the following: your name, your location, and what your connection is to family childcare, whether you're a registered home provider, certified home provider, or a partner agency staff. So I will start. My name is Carol Peterson, and I am a policy analyst with the Child Care Licensing Division. And I am going to be the facilitator for this discussion tonight. And I'll hand it off to the other CCLD DELC staff that are present. And so, Abby, you're next.
Hi, good evening, everyone. Thank you for joining us tonight. My name is Abby Strom, and I am also a policy analyst with CCLD. And I will pass it to Allison.
Hey everyone, I'm Allison Delory. My pronouns are she, her, and I am the Child Care Labor Liaison here at DELC. And I'll pass it to Jenny.
Hello, everybody. I'm Jenny Souter. I'm a regional manager for Child Care Licensing, and I am in the Portland North region. And I did see Fabi on here. Fabi, you want to introduce yourself?
Hi, I'm Fabi. I'm the executive assistant to Alicia, which is the CCLD director. I'm just on here, just making sure that the meeting's going well. But I won't stay the entire meeting, just popping in.
And Tina?
Hi, I'm Tina Barnes with Two Grannies Child Care. I am a registered family child care and hoping to help with changing some of the rules. I'd love to be a certified family. I just don't agree with some of their rules.
Okay. And Denise?
Hi, Denise Hudson, and I'm with the Central Region for Child Care Resources, and I am the Training and Education Manager here. And I'll pass it to Kelly.
Am I there? I'm there. Okay. My name is Kelly Heichel, and I am a certified family child care in Douglas County. I have 2 locations, and I'm also the pro facilitator.
Gabrielle?
Hi, my name's Gabby. I am in Springfield, Oregon. I'm a registered child care provider. Relatively new. I just opened up last October, so coming on in a year now. Soon.
Welcome. Rose?
I'm Rose Daly, and I'm from North Bend, Oregon, and I have a certified program in my home, and I've also, well, before that I was registered in my home program.
Great. And Danny?
Hi there, Danny Sam Thomas. My pronouns are she and her. I live in Salem, but I work in Clackamas County. I am from a partner agency here representing early learning hubs, but in previous lives was also quality improvement specialist and family child care network coordinator.
Great. And Claudia?
Hola, buenas noches. Soy Claudia Morales, estoy en Beaverton y soy proveedora certificada.
Welcome, Claudia.
Thank you.
And Anna?
Hi, I'm Anna Pical. I am in Southeast Portland. I have been a family child care provider for 12 years. I am also one of the representatives of our family child care union, AFSCME Local 132 as well.
And Annalise?
Evening, everybody. My name is Annalise Shahan. I am a union representative on the work group. I have a certified family child care in Clackamas County, just outside of Gladstone, Oregon. And I also do trainings and all kinds of stuff, wear many hats. So lots of connections to the family child care world.
Great, thank you, Annalise. And Flor?
Hi, everybody. My name is Flor Silva. I am in Hillsboro, Oregon. I used to be a childcare provider. I started as RF and then I moved to certified for more than 10 years. And now I work for CCR in Washington County.
Okay, great. And I want to confirm, has everybody gone? Oh, looks like Liz.
Oh, Liz is an interpreter.
Oh, okay.
But I need to move Liz over to that. And then I also wanted to point out that Heidi is currently stuck in traffic, but she says hello, and she's a provider in Northeast Portland.
Great, Heidi, thank you. Well, great. Well, I just want to briefly go over the meeting agenda for tonight. So we are gonna kick off the meeting by reviewing some group norms. We'll go over some of the work group guiding questions. We'll provide you a follow-up from last meeting's topics. We'll take a break approximately an hour into our session. And then we'll go ahead and address the discussion topics for this session. The first are dealing with outside requirements, and that will be ground cover, the ability to use an alternate outdoor space and trampolines. Then we have discussion topics pertaining to inside environments, which is dealing with the number of toilets needed in a certified home, the temperatures, internal temperatures, and screen time requirements. And then we will close out the session and I'll review next steps with you.
I also we had one person that we
missed.
Carmen, I believe, is here as well.
Oh, I didn't see a hand.
Oh, sorry. I had a mom I was dealing with.
Oh, you're totally fine.
So, Carmen Wolf, I'm in Hermiston. I'm like, I think 27 years in. And yeah, it's been a long day.
Do you have a certified home or registered?
I am certified, yes.
Certified. Oh, great.
Yeah.
Well, welcome, Carmen. Glad you're here.
Thank you. Yeah, thanks.
Are we, anyone else, Abby, that we? Okay, good. Okay. So these group norms are the same ones that have been presented in the previous meetings. The goal of these norms is not only to help ground us in the work, but also serve as an agreement with each other so we all can work together during our time tonight. So I'm going to briefly just go over them. We want to allow opportunities for all voices to be heard. We want to remain focused on the scope of the work group. Be open for respectful discussion. Encourage and honor individual perspectives and truths. Use the raise hand function or chat for comments. Practice active listening and seek commonality. So as we're moving through our work group discussion topics, some guiding questions and thoughts to consider is, how would this requirement look in a family childcare environment? What resources may be needed to implement the requirement? And what recommendations do you have to alter the proposed requirement that would better suit a family childcare environment? So we're going to start diving into the feedback and follow-up from past meetings. We're going to start with most recently our discussion on storage of hazards, the roles and responsibilities of certified home staff, and we're going to talk about the declaration of viewing since we do have some guidance on that now. So the feedback we heard on how hazards could possibly be stored in a more flexible fashion for home care was either in a room that children do not have access to or storing items out of reach. Things used often like diaper cream, sanitizers can be out of reach but not locked. And examples of stored out of reach could be high and out of sight or hooks for items 5 feet on the wall. Those were a couple of samples. So based on that feedback and some other additional research, we did draft some language, and the proposed language is reflective of what we heard last week regarding how the rules can be written to provide some flexibility on how hazards are stored in a family childcare home while still ensuring the health and safety of children. The proposed rule language on this slide also aligns with center rule language, which was drafted by using a combination of several other states' rules, as well as some national resources. As you all brought up during the last work group meeting, certain items will need to be stored differently, such as medication, marijuana and marijuana products, firearms, and other similar hazards would require to be stored under lock or in a locked room. So one exception I did want to point out to the medication requirement is for emergency medication, which we are proposing to allow items such as EpiPens or inhalers to be stored close to a caregiver, but inaccessible to children. So that will aid in your ability to grab it quickly and not have to go ahead and go to a locked area in order to retrieve the item. Another important thing to note is that this will not include diaper cream or sunscreen, which we are proposing to allow to be stored out of reach of children. So when reviewing this proposed language, does this make sense for a home environment? So when we're looking at inaccessible to children, the definition will read, means out of reach of children by meeting one of the following requirements: secured with a child safety device, such as a child safety cupboard lock or doorknob device, a device specifically manufactured as a child safety product, or for a product not manufactured as a child safety product, the device must have a multi-step opening process or require 2 hands to open. So an example of that could be a carabiner. I know when I licensed, I see a lot of carabiners where people use those in lieu of a standard child safety lock. The other option is that it can be locked, such as in a locked room, cupboard, or drawer, or locks that do not use a key or combination, such as a deadbolt or hook and eye latch, only if they are installed at least 60 inches high. Another option is behind a properly secured child safety gate, or the last option is in a cupboard or on a shelf that is not within reach of any surface where a child could stand or climb. So I'm interested in hearing your initial thoughts on this proposed draft rule language. Does anybody have any feedback for us? Yes, Tina.
I think that sounds very reasonable, and I agree with the wording.
Okay, great, Tina, thank you. Any other clarifications that would be beneficial to include, or is this workable?
I have a question. So it's the part where it's saying only if or installed at least 60 inches high. Let's see, where did I read that at? A drawer or lock cannot be used key, installation, blah blah blah. Or in a cupboard or shelf that is not within reach of any surface from where a child could stand or climb. So, like, let's say, for example, I have a kitchen cabinet. My kids do not stand on my counter, but if a kid got to a chair, they could reach the counter, and 60 inches up, they could reach a shelf even with a lock on it.
So keep in mind, these are two different items. You can have it locked. And if you use like a hook and eye latch, it needs to be installed 60 inches high, or it can be in a cupboard or on a shelf that is not within any reach of any surface from where a child could stand or climb. So you could move the chairs away, you know, and make sure that the item could not be accessed. Did that help clarify, Rose?
Yes.
Okay, thank you. And Abby?
There are a couple things in the chat. Heidi says, I think that this sounds good. Anna says, sounds good and is straightforward. And Danny says, seems solid to me. Yep. And I want to also point out that hopefully this allowed, we heard discussion last week about how, you know, this is your home and there are products in your shower and razors in your shower that hopefully, you know, these items can just be stored out of reach, right? So, you know, a container up on, you know, like I have up in my shower that is a high basket, so that hopefully some of these products, you don't have to every morning try to remember to lock it up somewhere else. So we're saying that these items can be just stored out of reach. So hopefully it provides some flexibility to you just as you operate your you know, day to day and your normal life outside of work, and then also while you are caring for children. Annalise says, I appreciate that we are balancing safety and prevention with the functionality for providers. And Kelly says, I think this addresses what we discussed.
Great. Well, if there's no other feedback, I'm gonna move us forward. So we're going to start with the roles and responsibilities of caregivers. And this is specific to certified home staff. So when reviewing this information during the last work group meeting, the duties that an assistant one could possibly complete that would not require sight or sound supervision by a provider were initially identified as taking a child inside for diapering or toileting, or walking a child to the bus stop. The suggestion did come up about supervising sleeping children as well. However, the intent of the proposed rule is to allow an assistant one staff to supervise children for brief periods of time. So supervising children during nap time may not fall under that allowance. However, as stated in the slide, the exact rule language is still getting worked on and is under review with the rulemaking team. And so I did want to let you know, though, just the update of kind of where we are at with that. And in addition, at the last work group meeting, we did discuss Assistant 2 qualifications. And the feedback provided was that someone who is fully enrolled in the CBR and has taken all the initial safety set training should be considered an Assistant 2. So we did take that into consideration, and we are looking at taking in other experience towards qualifying somebody as an Assistant 2 by allowing them, if they were an Assistant 2 at another certified home and they work there for 60 hours, they can automatically transfer into your certified home without doing an additional 60 hours. So we're hoping that will provide some flexibility with staffing, and meet some of those staffing hurdles and barriers that people are experiencing right now. The one caveat to that is that the safety set trainings need to be current, and an orientation for the particular site has to be conducted before that individual could be considered an assistant to at your home. And we're hoping that this does honor people's past work experience at other certified home programs, while still building in some safeguards about new staff knowing your particular program policies and emergency procedures that are specific to your home. And one other thing that we're recommending is keeping the 60 hours of experience in the home where they are employed in order to serve as a substitute provider. So we found we feel it's very important that people have a understanding of the flow of your home, know the children, are able to go ahead and step in for you while if you need an assistant to serve as a substitute provider if you ever have to leave your home. So any initial reactions or thoughts on these two proposals? Yes, Rose.
I think that, I'm sorry, but as I'm coming from a rural area where there's not a lot of childcare, there's not a lot of whatever, how are we expected to bring someone in for 60 hours to work as whatever and not be able to leave them? It's just, to me, it doesn't seem feasibly possible.
So that requirement would only be for a substitute coming in and serving in your absence. They would have to have a week and a half, basically a week and a half of experience so that you can confirm that in fact they are, they know the children, they know your policies, procedures, emergency plans, and they can understand the flow a little bit. Tina?
Yes, I agree with her. It's really hard to get somebody to substitute for you and afford to pay a substitute for that many hours to get somebody that will be qualified if I have a doctor's appointment or I'm the only one that works my daycare. And so just trying to find somebody that can cover for half a day because I have a doctor's appointment or something to be able to leave them alone, it's difficult. What about if they are a sub and they have a combination of 60 hours? Is that something that would be feasible?
Can you explain a little bit more of what you mean by a combination of 60 hours and being a sub?
Well, like if they are signed up with the sub through the state, where they can go and sub at different people's houses. Say they've done 20 hours at Becky's and they've done 10 hours at Renee's and they've done, so they have a total of 60 hours working in a child care, just not your child care.
Okay. So that's something that we can take back to the rule making group and use that as a proposal.
Yeah, because a lot of us, I'm pretty sure I'm not the only one. I can't afford to hire somebody to get them the 60 hours when all I'm going to use them is a day here or 2 days here or maybe a week when I go on vacation. I don't have the funds to hire somebody for 60 hours just to have them available to work here and there.
Okay, that's really good feedback. Thanks, Tina. And I think Annalise, you've got your hand up.
Yes, thank you. So in the bottom right box, sorry, I got another family going home. So there's a little bit of noise. It says where it says can be an assistant to with 60 hours of prior experience in a CF. if safety set trainings are current and an orientation for the particular site has taken place. I just want to reiterate what Anna Piquel said last time. If someone is, I think we need to look at really what this rule needs to look at is the difference between an assistant 1 and an assistant 2. So an assistant 1, right, or assistant 2, let's say an assistant 2, right? They are someone who is fully enrolled in the CBR. That means they are at least 18 years of age. That means they have cleared a background check and they can be out of sight and out of sound of the provider. So the CBR by definition should allow an assistant 2 to be someone with a CBR, acknowledging the CBR regulations and law. They've taken all the safety set trainings. That person should be an assistant 2. They should not need to have prior experience in a CF or in an RF or childcare experience prior. The CBR, and I feel very strongly about this, the CBR by definition, along with the safety set trainings, should be enough to be an assistant 2 right off the bat. If the safety set, the CBR, and one could argue what the safety set is, if it includes sanitation and food handlers and all those different things, right? But the presumption would be that a provider, an assistant, well, the provider themselves could, in fact, with the CBR, the safety set, all of that entry level material, as long as they were 21, could open their own licensed program without 60 hours if they have the training.
Well, they need
meet the ORO steps.
Yeah, which as you well know, it involves, in order to get to that step level, it does involve quite a bit, but we'll go ahead. We've captured that information and we'll go ahead and take that forward. Abby, you've got your hand raised.
Sure, there are just a couple things in the chat, and I believe Rose, or how does this work in rural areas? What if they, and then Tina's comment about the combination of hours in subbing. Kelly says, yes, we don't have the workforce. It's not easy to find staff in rural areas. And that could be, Heidi's suggestion is that this could be addressed by expanding the orientation checklist. And Rose, why are we allowed to use, oops, I'm sorry, the chat is moving. So it's as people take more. Why are we allowed to use subs from the pool? And I have an answer or a comment on the substitute pool when we get to the end of this as well. Heidi says, I believe that lead subs from the program are good to go without the 60 hours. It's been an enormous topic in the Sun group. I'm not sure Sun maybe means the subgroup. Perhaps sub folks could coordinate with you all regarding this point. And Heidi says, I totally agree with Anna and Annalise regarding CBR and safety set for assistant 2s. And Danny says, what about experience in certified center and other types of early childhood settings? You can have steps and no experience. And then Denise says, good point, Danny. I do want to bring up just one thing about the substitute pool. And I've been involved in some of the conversations with that. And I actually have a reminder on my calendar for this Friday to reach out to, is it CSSO, Child C or CCSO? Can't remember their acronym there. But we have actually requested that they track some data on how many certified and registered family providers are calling into specific, mostly for certified family folks, that are specifically calling in to substitute for them. So not for an assistant 1 or an assistant 2, but more about substituting for the provider because of that 60 hours that we're talking about. And that's on this slide as well. So we really want to gather that data to help us make an informed decision about what next steps are with that 60-hour requirement as well. So if we're seeing a lot of folks calling in for substitutes, specifically for the provider? Like, do we look at changing the rule, or maybe adding a rule about folks that come from the substitute pool, to get to Heidi's point, to provide more flexibility so that those subs have you have more access to substitutes. So there is some collaboration going on with the folks at CCSO. Thank you, Al.
Okay. Are there any
Can I
other?
add just something before we move on, Carol? I
Yes.
was part of the first conversations with FCC, SO, whatever it is, with the substitutes too. That was something that we were asking very strongly about, the 60 hours in each program. So it was my understanding that they took it to the ELD and now DELC, and they said that that was not something that they could take off. So I don't know the way that we could work around it. It would be great if we could, because that is something that is very needed, but with the 60 hours, it's just not feasible, really.
Okay. Thank you. Abby, are there any other comments?
Heidi says, it's been all we've talked about in the sub-advisory panel. It's huge. So this is really valuable feedback for us to take in combination with what we hear from CCSO as well.
Exactly. Okay. I'm gonna move us forward. Oops. Well, now my slides won't advance. How weird. Let's see. There always has to be some technical glitch. There we go. Okay. So this was another topic of the roles and responsibility of caregivers specific to certified home staff. This discussion item was regarding the number of hours that a substitute provider or substitute assistant to staff can work in the home prior to needing annual training. If you recall, the current rule reads substitute providers and volunteers who provide care in the home for less than 20 hours in a calendar year are not required to participate in the 15 clock hours of training. So we're proposing to raise the number of hours from the current 20 hours to 240 hours. However, we heard your feedback about the possible conflicting rules, since many assistant to staff who regularly work at a certified home often serve as a substitute provider. We wanted to clarify the language so it clearly reads who is required to take ongoing training hours and when. After reading the altered proposed rule language, does that clear up any potential confusion or conflicting information? So what we did is we added in the bolded part at the end where it says assistant twos that substitute for the provider must meet annual training requirements identified in 414-360-03401. And so we're hoping that that helps kind of clarify what our intention is. Are there any thoughts about that wording or the overall concept? Abby?
Oh, Annalise also had her hand up, but I'll just
I'm sorry.
quickly. Oh no, it's fine.
I can't see who has their hands up because my little someone has their hand raised is over. So my apologies.
I will just quickly go over. Heidi says that please do raise, and I think that that's in reference to the number of hours, and that she has four part-timers who she shares with other programs, and it cost me a fortune in continuing education hours. Anna says that that's great, and Heidi says it's great, hooray.
Okay. Sorry, Annalise, now you can go.
That's right. I was just going to raise kind of what Heidi did, but a slightly different perspective. So if you have substitute providers, substitutes who provide care, who substitute in a number of programs, it would be a little concerning to me personally if this was a loophole that they didn't have to do continuing education, because if they're working in a program, in several different programs that are sharing them, I would hope that assistant twos, so that last sentence on proposed language, assistant twos that substitute for the provider or multiple providers or substitute in childcare programs must meet annual training requirements identified in 414. I think there's an extra piece there that's kind of missing.
That's a good point.
Personally,
yeah.
We've never floated that boat for the union, so I cannot speak as to what our union's position would be on that, but I think there's another piece that's missing. The assistant twos that substitute for multiple providers and are regularly working X number of hours in a week or a month or a year must meet annual training requirements identified if they meet those requirements over several programs, right?
Yeah.
And there's a huge difference, let me just say, I feel pretty confident that our union would say there's a huge difference between assistant twos job sharing and assistant twos that are substituting. The other thing that I'd like to say at the top, just a little wordsmithing. So substitutes, or I guess substitute providers. No, I'm going to change the back. Substitutes who act in the stead of a provider or as an assistant to who provide care. Because I think you're really talking about, and I really think we need to parse, or we're going to have some ambiguity in this rule. Who needs the 240 hours? And the intention here, I believe, is that people who are substituting for the provider and who are substituting for other assistant twos, for any assistant twos, don't need the hours until they hit 240, right?
Correct.
So I think that creates some ambiguity, the way it's currently written.
Okay. That's great feedback. Thank you. And Abby?
Just one additional comment from Heidi here that says that what would be super smart is to change continuing education to a calendar year so that it's not dependent on the program. And I think one of the challenges with that is the rules pertain to programs and not an individual. So although we could research to see if this is something that we could do. I just know that the rules apply to the program, which, yeah, it might be difficult to work that out, but it's definitely something we could research.
And I can't see, are there any other hands up?
Yeah,
Okay.
it's Annalise again. So,
Okay.
but following up on what Abby and Heidi both said, I think that there needs to be, while you're in these rules, there needs to be a way to pull out the substitute language. And I believe that that's a section, and it's its own section in the rule book, but we cannot continue to have substitute providers continuing ed tied to an individual program, because here's the problem. I'm working in a program, and let's say they renewed in July, and then I have another program that I'm working in and they renew in January. It's going to be a problem, and programs that have people that own two or more programs and they have staff that go between the locations already experience this. For regular staff. It is possible that when you, and they have this problem with Preschool Promise, running this issue with Preschool Promise, because it is possible, and there are cases where a provider, where an assistant to or a substitute or someone takes classes in between and gets their 15 hours in and then is not, or some hours, and is not able to use hours on one licensing renewal, but is able to use hours on the other licensing renewal. And so they end up having to take more than 15 clock hours because the two licensing periods do not overlap. And they're taking too many hours in one licensing period and not enough in the other. So I just even allowing for an exception to the rule, or just, you know, being careful with that. But I'd feel better if it was if there was something written into the rules that brought clarity to that issue.
Great, thank you. Are there any other comments?
Just another comment from Heidi that says she agrees with Annalise that I chair staff with another center with the exact scenario. We both wind up paying beyond the expense. It's just not a lot of paper. Look at how out of date Oro is.
Okay.
So I think we could take it back. I think the specific about like or it's too much paperwork. It's definitely something we can also look to address the specifically if you have staff working for multiple programs with the same owner. That is something that we do have for certified center because it happens quite frequently. But we can see if there could be if we could kind of expand that idea also to certified family childcare.
Okay. So if there are no other comments, I'm gonna move us forward.
There's one more comment just about I'm assuming this is to the Oro piece, is that Heidi just says it contributes to staffing shortages and creates a bottleneck.
Okay.
Yes.
So I want to bring us back to some information about the declaration of viewing topic that we discussed during our first work group meeting. So based on your feedback and all the input we heard during the listening sessions, we are proposing a few changes to the declaration of viewing requirement. We took we took your feedback back to our leadership, and they went ahead and worked on some alterations to it. So the exact rule language is still being drafted, but we're proposing that parents will not be required to sign a document or indicate that they've viewed the license upon enrolling their child, nor will they need to sign the declaration again if an exception to a rule is granted for a family care program. We heard you that you're required to go ahead and post your license. So, you know, that should be adequate. We are, however, looking at options regarding parental notification when there's a potential for conditions or restrictions being placed on a license. As with the other rules that are currently still being drafted, when the rules are available during the public comment period in September, that will be an opportunity for you to go ahead and provide your feedback and information at that time when we have all of the draft rules in place. So hopefully that gets us a little closer to what you were suggesting to us at the initial work group meeting. Is there any feedback on that? Okay. Well, I'm gonna move us forward if there's not any. So we are just a little bit early. I think let's go ahead and go do one more. We'll start on the discussion topics, so we have enough time to cover, because there's a couple of the discussion topics may take a little while. So we'll go ahead and break in 15 minutes then. So we're going to start off this session's work, the work group, with the outdoor environment with ground cover requirements. So in the certified home rules, the current rules read that the outside activity area shall be suitably surfaced and well drained, and that playground equipment such as slides, swings, climbing structures, and other elevated equipment shall be surrounded by a resilient surface of an acceptable depth, or by rubber mats manufactured for such use according to standards of the U.S. Consumer Protection Safety Commission, which is CPSC. Currently in registered home rules, there are no specific requirements for outside ground cover. So the CF proposed rule change is we are going to align with CPSC requirements, and the rules will address those specifics on ground cover types, the depth of surfacing, and use zone requirements, which is the ground cover under and around each piece of equipment. Additionally, the rules will address that ground cover will not be required for any equipment lower than 18 inches. So that's for the certified home rules. For the RF, the proposed change is that elevated play equipment taller than 18 inches may not be placed on concrete, asphalt, lumber, or similarly hard surfaces. So the rationale behind making some of these changes is, according to CPSC, each year about 50,000 children go to emergency rooms because of injuries on home playground equipment. And about 80% of those injuries occur when children fall from the play equipment. Children are also injured when they are hit by swings or other moving equipment. And in addition, the National Program for Playground Safety states more than a third of emergency visits for playground injuries involve preschool-aged children, and that falls from climbing structures cause the most serious injuries in early care and education programs. So some of the rule language that we will put in, that we're proposing to put in, is about the acceptable materials, which contains wood mulch, double shredded bark mulch, shredded or recycled rubber, pea gravel, wood chips, and things that are listed right in CPSC. If you are a certified home, you probably have received a rule guidance document that our agency developed in order to help people understand what the requirements are. And so we took a lot of that information from the rule guidance document and placed it into rules so that it clearly states what the expectations are, and you guys will, fully understand what the requirements are versus having to kind of guess whether or not a certain type of bark chip or a certain type of playground material is sufficient and meets licensing rules, and then also is the adequate depth. So any feedback on these proposed changes? Abby?
Sure. Annalise just wrote that CPSC for residential isn't requirements, they are guidelines. The preamble of their guide clearly states that these are recommendations and guidelines, and she just wants to be sure that we are using the correct terminology, that the recommendations are not requirements, and that I guess so we could say we are proposing to adopt the recommendations and guidelines from CPSC. Yes, so Outdoor Home Safety Handbook.
Anna?
I will say I think this is good that it will be added to the CF rulebook so that the requirements are more clear, given that right now it's very ambiguous sometimes for people to know what is required for them. However, I guess I would give the additional recommendation that if our, sanitation inspection that happens annually has determined that our fall zone is sufficient and meets requirements, that our licensing specialist doesn't come in and tell us something different.
Okay, that's great feedback. Thanks, Anna. Abby?
I won't read Danny's comment because she has her hands up.
Oh, okay.
But Heidi says, I think these are great changes. But please know that bark chips are expensive, and that Heidi spends over $2,000 annually. So it is a bit of a sticker shock if you are not used to refilling and replacing wood chips, because it does happen. They do have to be refilled and replaced. And then Danny, I'm guessing you're gonna speak to your own comment.
I will. Thanks, Abby. Yeah, I made one and then realized I actually have more. So knowing that this is in existence already, and this is going to be a high cost for some providers to put a covering under things that don't, RF providers in particular, because there's no requirements for them right now. So then to say they now all need to do this, is there some sort of on-ramp to these changes where they will have time, an action plan, something in place to be able to get these together? Because most of this is going to be a cost. Like you can't just go out and do that.
With registered home, the proposed change is just that the elevated play equipment taller than 18 inches may not be placed on concrete, asphalt, lumber, or a similarly hard surface. So they're not going to be required to have the ground cover that certified home rules will require. Does that help provide clarification?
It does a little bit, but that means they're going to need something softer like the ground cover things. So I guess the question is how many providers have things that are 18 inches tall already that are not on a soft ground? And then, what does that look like for CFs as well? It can be on grass, right? Sure.
So with the RF, they would be able to have their play equipment on, their climbers on grass. So the CPSC, the ground cover requirements will kick in for for certified home providers, but it was also already a requirement for them. We're just clarifying exactly what they need. Tina?
Yeah, I have to disagree with the fact that certified has to be different than registered there. There are plenty of certified daycares that are in people's homes. I feel like it should be the same requirement as registered. If you're going to have a play structure in your yard, she's right. Bark chips are very, very, very expensive. And a lot of people don't want to cover their yard with bark chips or mats or whatever. And if you have a certified family in your home, I just don't understand what the difference, why it's required for one and not the other. I can see centers because they're usually in a building somewhere, or there's way more children. But I think registered and certified should be the same, and it shouldn't require you to have ground cover.
Okay, thank you. Annalise?
Yeah, thank you. I sort of agree with that, what was just said.
So I think I would advise that this goes back to the rule writing body at Delk. I think the ground cover piece makes sense. But there is a huge difference between having a yard for 6 preschool aged children and 16 preschool aged children, vastly different. So the argument about ground cover doesn't really hold up for a CF. If you're not going to require it for an RF, and it shouldn't be required for an RF, I totally agree with that. But these are residential, right? The CPSC is very honest about that. These are recommendations, these are guidelines, that there's not a requirement. That these are not requirements and they should not be used for licensing rules. But that said, there are some practical pieces in there around spacing and whatnot that do make sense if you're going to have more children playing in that play space. I would argue that a better rule for a CF and for an RF, quite frankly, would be that there is a written safety plan. It can be submitted. I wouldn't say need to be approved, but definitely submitted to licensing with the application to address CPSC standards to the best practicable ability of each location, because I think some of this is highly specific to the location. And not necessarily write CPSC recommendations into the rule book. Think what makes more sense and what shows that the state recognizes the professionalism, the work we do with insurance, the business mind, the responsibility, the validates the respect for the professional provider at each location and the owner, if those two people are different, that they have taken steps to minimize risk to children, that they've worked with their insurance company, that they've considered all of the best practices and whatnot. And really have given it due diligence, because creating a blanket rule like this doesn't necessarily protect kids. The rule CF already requires, like, for example, CF already requires ground cover, but I'm aware of 2 children that have been injured in the last couple of weeks. They didn't fall off the equipment. They were injured on the equipment itself. The ground cover did nothing to prevent their injury. So my advice would be a written plan for the outdoor play space that ensures as much as practicable, much as possible, the safety of children, and not try to regulate using the CPSC recommendations.
Thank you. Abby, you have your hand up?
Yes, there are a couple things in the chat. Rose says you have to pay to upkeep rubber mulch filled too. And what about certified mats? And I believe that some of the proposed rule language does address like rubberized mats, poured in place mats as well. Anna says that RF can use grass, CF cannot. This will make the process of transitioning from RF to CF much easier. And Carmen says that isn't the danger of the height the same? Why is one different? I pull more slivers a day from bark and pea gravel than they try to put in their mouths. Carmen, and I'm not sure danger of the height is the same. I think I would have to, we'd have to know a little bit more about your question before answering it. And why is one different? I'm not sure if you're referring to the the type of loose fill material itself, or whether you're referring to RF and CF.
Carmen, is she, can you tell if she's typing or?
Sorry, I was just
that's
chatting.
okay.
I was on my own little time zone there. So I guess I was saying is, but when I was registered, I had the same play equipment. So when I was registered, didn't really matter. It was on grass. It was fine. And then got certified, and now I have to have, the ground cover, which I get. So I guess technically when I was registered, I had 3 layers of horse trailer mats under my equipment. They were spongy. It was great. And then that was great then. But then when I switched over, they're like, well, we don't think that's regulation. We don't think so. She tried to find out. She never could find an answer. She I don't think it's going to work. So I had to go to the bark, which, like I said, I pull more slivers a day out of bark, out of feet and hands and knees. And then I had pea gravel in one section, which, the little guys, they just want to put in their mouths, or they want to find a cup and, throw it over the grass. So I just was wondering what the difference was. I haven't changed my equipment, but my ground cover had to change, which gets expensive because they just throw it everywhere. So
yeah,
that's just one of those things, I guess, but
thank you, Carmen.
Yeah.
Tina?
Yeah, I think I'm a little confused because some people are saying that it's a suggestion, other people are saying it's a requirement. I was always told for CF it's a requirement for the ground cover, which I disagree with. I think it should be a suggestion, not a requirement.
Okay.
And it shouldn't hold you up on being, that's the one reason and only reason I haven't went certified. I could hire a person, I could have more kids, I could provide more spots for my area, but I can't, I'm not putting bark or rubber all over my yard. So
one option is if you don't have any equipment that's above 18 inches, you don't have to have any ground cover whatsoever. You can have grass or, so you can do balance beams, different things like that, or, balls and stuff. So there, maybe that might free up some options for you.
I have 2 play structures that are less than 4 feet tall, but they still require ground cover if I go to certified. I think that it should be like I said, a suggestion, not a requirement.
Okay. Thank you, Tina. And Abby.
Yes. Danny says, so we consider grass soft even those the recommendations we are using suggest that they are not soft, but grass is only soft for RF. So and I think we're just saying the proposed RF change is just that the elevated equipment over 18 inches cannot be on concrete, directly placed on concrete, asphalt, lumber, or similarly hard surface. A lot of play equipment is on grass. Although I imagine if it was very hard, like the raw or the ground underneath may be similarly hard, there may be they may be asked to either move the equipment or not use it. But we do not say that it can't be on grass. It could be on grass. Anna is saying that she's clarifying the statement that says that she meant to say that it would make the transition from RF to CF more clear, not easier. And Kelly says exactly. Licensors saying it's required and measuring it, and that's probably the ground cover for certified family. And yes, my understanding is that as well, is that a licensing specialist will measure the ground cover. And Jenny says loose parts are very engaging, such as pea gravel. Tina says, and that should be for both RF and CF, and I'm guessing she's referring to it being a like a recommendation versus a requirement.
Okay. Well, if there are no other comments or feedback on this, what we'll do is take a quick break. So it is, let's come back at 10 after 7, and we will continue. Okay, I'm going to move us forward. So one other alteration to the outdoor environment rules that we're proposing is under the current certified family rules, if a certified home provider would like to use an area park or other, like a school or something like that, instead of their own yard, that would require a formal exception to be processed and approved. We're proposing a new option for this rule, which would allow for a written plan to be developed by the provider. And the benefits of that, it will help expedite the process, so you wouldn't have to wait for the exception to be processed and approved. The rule will outline what is required in the written plan. Additionally, we're looking into the possibility of creating a template that will outline the rules, so that would make it easier for you all to complete, if in fact that is something that you wish to go ahead and pursue. The written plan still will need to be approved by CCLD and describe how the home will maintain the safety of the children in care, and the rules will outline what needs to be included in the plan. So we just wanted to let you know that this is a proposal that we are hoping moves forward because we do think that it would be a benefit for many programs that decide not to use their yard for childcare purposes. And Abby.
So just a couple things in chat. Annalise says, makes sense under the same logic that she mentioned for the CPSC recommendations not becoming rules. And Heidi says, brilliant, a template is smart, streamlining is smart. And Anna says, this aligns well with CC rules, and yes, it does.
Yes, great. Any other feedback?
I have a quick comment.
Yes.
So if you're asking certified to have ground cover as in rubber mulch, pea gravel or bark, or certified mats, but yet you're going to allow certified providers to take kids to a park where they have sand and not necessarily at the certain fall depth or whatever it is that you're requiring us to have as if we had it in our yard. How does that kind of make sense to the rules?
So that will be a part of the written plan that will address the availability of appropriate equipment with fall zones and protective surfacing. So you would need to write that into your plan of what you observed and what potentially that looks like.
Sorry, but that still doesn't answer my question, my problem. My problem is you're requiring us in our homes to have the mulch, pea gravel, or the bark as a ground cover, but yet you guys are going to allow for them a provider to take the kids to a park where they don't necessarily have that. So how do you kind of balance that out as what's fair for one and what's not fair for the other?
Well, this is just an option. It's for people who maybe don't want to use their yard, but they're going to go ahead and use a park that's right across the street. And the park does have rubber matting. It does have safe equipment. There's just, it's an option that we're trying to go ahead and put out.
Okay, but I'm just saying that not every park in every community has rubber mulch, bark, pea gravel. I know for a fact in Coos County where we live, None of the parks have that. We have sand.
You know, well, sand could potentially be
Not what you have listed in your thing. You said specifically in there, it said rubber mulch, recycled rubber mulch, bark, or pea gravel. It does not say sand.
Those were just examples. That was not an exhaustive list, and my apologies for not stating that. I do think sand is an option. I put etc. in there, and so my apologies that I didn't cover all of the options.
Okay, then you need to go back to that with licensing, because I know for a fact when I went from RF to CF, I had to literally jump through major hoops about what was acceptable and what was not acceptable. And what was not acceptable at that time was sand. I was told the only thing was acceptable at that time by the sanitation inspector and the licenser was that my options were pea gravel, rubber mulch, or bark, or the certified mat.
Yeah. I can't speak to that, Rose. I don't know, Jenny, do you want to go ahead and speak to Rose's concern?
You bring up really good points, Rose, and I want to acknowledge that for certain. And we can go back and look. I also thought that sand was on the list as being, oh, Danny, did you find it? As being acceptable. I know I had it in my programs in the past, and in California, it was definitely acceptable in that state. We can definitely look at it. Definitely hear your concerns. I can't speak to your exact situation because I wasn't there, but we will take this forward. That's what this meeting is all about.
Yep.
But then, like I said, it goes back to we're in this to make these rules and to make these clarifications. So it goes back to what you have listed in the thing, and then you have a licensor that comes out and says, well, it doesn't specifically say this, so we have to do it this way. So it goes back to interpretation. So what you guys are coming out from DELC and what the licensor or whatnot is coming back at is two different things. So it all needs to be clarification all the way across the board, and not just what your guys' perception is and what licensing is and what Tommy Jones is. It all needs to be the same.
Okay, thank you. Abby?
Sorry, I was on mute. There are some comments in the chat. Annalise says, excellent point, Rose. And I think about using the use of public park versus your own home's outdoor space. And Kelly says, so it wouldn't pass if it doesn't meet those standards. And Kelly, I think I'd have to know a little bit more about if you're asking like if the public park didn't meet those standards, or if
that's what I meant. If the public park didn't meet those standards, that's what I was talking about.
And if and the public park has very different standards than a well, actually they're quite similar actually to home. The recommendations for CPSE for public parks are very similar to home. They're just a couple of differences here and there. But if there were things that were considered to be unsafe, like as Carol mentioned, the program would have to have a plan. Maybe they don't use that specific piece of equipment. I've seen some parks that equipment is only, there are signs up that said it's only used for children ages 3 and up. So maybe only children ages 3 and up are using the equipment, but infants and toddlers are using, a different area. So we want to be able to provide flexibility for folks that do not have a space in their, an outdoor space, maybe that's not fenced. Or some folks don't want to make all the changes, right, that are required in here to have elevated equipment. Again, I want to point out that this is really, a lot of this is for elevated equipment. Tina asks, and how is pea gravel safer than grass? Pea gravel is a recommendation from CPSE. So, grass is not. So that's why we specifically call out pea gravel and not grass. Deanne says maintain, and this is cut and paste from, I believe, CPSC, maintain a minimum of 9 inches of loose fill materials such as wood mulch, chips, engineered wood fiber, or shredded or recycled rubber, of up to 8 feet, 9 inches of sand or pea gravel for equipment up to 5 feet. Note that the initial fill of 12 inches will compress over time to about 9 inches. The surfacing will also compact, displace, and settle, and should be periodically refilled to maintain at least 9 inches of depth. Use a minimum of 6 inches of protective surfacing for equipment less than 4 feet of height. And if maintained properly, this should be adequate. At depths of less than 6 inches, protective surfacing is too easily displaced and compacted. Yes, and I believe that is from CPSC itself. Anna says, I don't think that it's a provider's responsibility to determine if the fall zone is appropriate. Public parks are determined safe by the county or city park department. And that they're managed by the park department, or if you're going to a school, it's managed by the school itself. I think sometimes, Heidi says, I think sometimes there are sanitation inspectors have their own ideas, and I personally have had to ask, is that your opinion or is that a rule? And Annalise says from the book, appropriate testing, yes, there's ASTM F1, F1292. That's in reference to like rubberized mats and what they have to be. They're graded, and that's a international standard for mats and other materials. There's a whole bunch of list of materials. And Heidi says it would be helpful if licensing staff and sanitation were coached to be more consistent. This is an issue. And Heidi, I can tell you that we are working with environmental health as well as we are developing these new rules and checklists for environmental health, as well as licensing staff will be updated. So we're hopefully not checking on the same things twice as well. So we're trying to avoid redundancy between the two. Yes, on a very good point about the parks. Tina says, and how, there we go. Ground cover can help in some cases, but this is from Annalise, 22 years in childcare and working with providers through the union has shown overwhelmingly that it doesn't work more often than it does. Tina says, what I was saying is pea gravel is rock hard, is harder than grass, makes no sense. And then Carmen says, Sam would be great if I didn't have every cat in my neighborhood using it as a litter box.
Yeah. I did want to add the thing about pea gravel, and I hear what you're saying. It sounds like they're falling on rocks. It's the way it gives when the child falls onto it is why it's considered to be acceptable. And it's like the small little pebbles. So it's also being mindful of the small pebbles of the pea gravel that help give when a child falls. That's helpful.
Danny?
I guess my comment, I pasted some things in and you read them all, Abby. I think just being really careful about how you choose to align this with those standards, and the words you use are really important when you're writing this. I feel like it will be easier to respond to both of these. Like the last thing didn't have text yet, so I think that will be easier, like responding to an actual text, but just wanting to offer some caution that, you know, alignment here could be really great, but then how is that, you know, safer necessarily? Pea gravel is a choke hazard, Tina just said in the chat box, and I think there's, you know, I don't know if you all have ever hung out in bark, but it's not great either. So I'm nervous about saying that we would apply these standards to someone's home, even though these are home standards that they have outlined here, and not all kinds of homes. So like, I think the wording just has to be really careful, or you're gonna end up with loopholes like Annalise suggested, or things that you didn't intend to be part of a problem.
Right. Okay. Thank you. And so are there, Denise? Denise, and then we've got to move on.
Okay, just really quick. I always bring this up, but you have to think about liability reasons as well, and liability insurance. And then as a business, what is the safest way to prevent injury to a child? I always advocate for that as well. So that's what my
Thank
comment.
you, Denise. Okay. So now we're gonna, what, Abby?
Oh, there's just one other thing in the chat. Heidi says, thank you, Jenny. You are such a terrific licensing specialist person and have such a great advocate's mind for child safety, REP gravel.
Jenny is awesome. So we're gonna go ahead and talk about trampolines. So under the current rules, trampoline usage is not specifically called out. However, due to research about the risks associated with the use of trampolines in a childcare environment, CCLD is proposing to specifically state in rule that trampolines will not be allowed to be used in a childcare home by childcare children. So the rationale is this is supported by Caring for Our Children. Sorry, my keeps, there we go. It's supported by Caring for Our Children, American Academy of Pediatrics, and American Academy of Orthopedic Surgeons. They all recommend prohibiting the use of trampolines on site at childcare programs due to the risk of severe injury. The CPSC states that the number of serious injuries associated with trampoline use supports the recommendation of prohibiting their use in childcare programs. So the proposed language are that trampolines other than rebounders, and rebounders are the small, tiny little trampolines, are prohibited. Rebounders are permitted only when used according to manufacturer's instructions. So one thing I do want to point out is that trampolines can remain on the premises of your childcare home and be used by your own family. And this requirement only pertains to the use by childcare children. Any initial thoughts on this? Yes, Anna.
Are they thinking of having any language in the wording about how to make sure the trampoline is not accessible to childcare children? Because I know we can have other things on the premise, like a hot tub or a pool, but there are very specific outdoor requirements for us to have that. So that's the only thing I could think of is like, how are they going to want us to make that inaccessible to those childcare children if we have one?
That's a really good point, Anna. And we'll make sure that to take that back to the group and at a minimum come up with rule guidance if we don't put it in rule, or some sort of guidance for that. Abby?
In the chat, Tina says they should not be allowed. They are extremely dangerous, and this should be behind a fence.
Oh,
so that would be one way to make it inaccessible.
Inaccessible, yes. Exactly. And Anna?
I mean, if I were to make a suggestion on inaccessible, I would say they have those, like the tall safety nets that go around the trampoline so children can't fall out of it. And I think you could easily put a lock on something like that. And then that would very easily make it inaccessible to the childcare kids if it was locked. And then you wouldn't have to spend the money to build a fence or do anything overly exaggerated.
That's a good suggestion.
I also think that maybe having a technical assistance handout, kind of like when we did Safe Sleep with pictures, would probably be helpful because everybody might not understand what a rebounder is and exactly what that looked like.
Right. I had to do research on it because I didn't know. So when it was brought forward with the certified centers, I didn't know what that was, and so I needed to do that. So that's a really good point, and we will definitely look into that. Floor?
I was gonna say exactly the same thing because as now I do not know what a rebounder is. But anyway, I just wanted to point the same thing that she did just now. We need to remember that these are family homes and these families have trampolines and there's kids that enjoy jumping in the trampoline. And obviously building a fence, it's gonna be quite expensive. So whatever we're gonna put in there to be protective of the children not getting into the trampoline has to be price friendly, I want to say, so then we don't add cost to all the costs that we have to put into family childcare.
Yes, yes. Thank you, Flor. Carmen, do you have your hand up?
Yeah.
Okay.
I just had a question. So like I get trampolines. I agree they're dangerous across the board, but so I have something called it's a jungle jumperoo. I don't know if you've heard of them, but is there essentially like a big truck tire inner tube on a frame? So it's like 12 inches off the ground. But my kids use that, like they jumped and did the crazies out on that sucker. So those would still be allowed, wouldn't they? Because they're not a trampoline, but
Yeah, I don't, because I don't know what it
see,
looks
it's kind of like, I don't know if you can see this picture. See the light behind it. It's a frame, and they're made for 2 and up.
For 2 and up.
Yeah, and that's what they are. But they're just there's a solid frame, and the tube just goes over it, and I have a cover on mine. But I mean, they will jump on that sucker all day long.
Yeah.
It's only 12 inches. You can blow the tube as much. I keep mine about 12 inches.
Okay. Yeah, we would definitely look into that. Not knowing what that product is, I can't tell you either way.
Yeah, I mean, that's like their all-time favorite, but it's the wheels out.
Really like the idea of making that little practice guidelines that would have pictures.
Exactly.
Such as this. I think that's really helpful. Thank you, Carmen.
Yeah.
Yes. And Flor, is that an old hand or a new hand? Okay, thank you. And Abby.
I think I have like middle-aged hands. Sorry. Danny says, is there any language about this in current rule, or is this an addition? And this is an addition.
In addition.
We do not, we did have kind of some rule guidance around trampolines for folks to use. It is considered a piece of elevated equipment, although some trampolines can even be set into the ground. We've seen those as well. So we did have kind of recommendations for their use. But it was not specifically addressed in rules, so this would be an addition. Gabby says yes, netting or no step ladder, anything that makes the netting to the area accessible, and that probably would be a cost-effective way to prevent access to the trampoline. And Carol, I just mentioned that we have about 25 minutes left now.
Yes.
Danny says, depends on what the manufacturers and structures are in terms of using the jungle jumperoo, which I did put in case anybody wanted to see, I did put a link in the chat for what that is. And then it sounds like the same thing as a small trampoline, Tina says, in reference to the jumperoo. So
great. So I am going to move us forward. We're going to start talking about the indoor environment, and we're going to address the number of toilets in a certified family home. So what we heard during the listening sessions is the number of toilets required in a certified home rules should be reviewed, and it doesn't make sense that an additional toilet is required for one additional child, especially when infants are often included in the overall numbers of children in care. So our proposed change is we're proposing to remove the requirement of needing an additional toilet if the capacity is more than 15 children. So with that in mind, are there any unintended consequences that we are not thinking of if we take that requirement out? Yes, Kelly.
I'm going to say no. And after 26 years of doing this, I have 2 certified family, and one is 15 and one is 16. The one that's 16 has the second bathroom upstairs. And in 26 years, I've never had to use it, knock on wood. So I don't think that's going to cause any undue whatever, but it's going to open up an extra slot at my second site. So that's definitely a good thing. And I think it's going to help with the childcare desert as well.
That was the goal. That's what we that definitely we definitely want to help with that.
Yes, thank you.
Abby?
Yep. Similar comments in the chat. Excellent change. There are no unintended consequences. Tina says great change. Heidi says hooray. Remove the toilet. Open up possibilities for expansion. Woohoo. Yep.
Okay.
This also aligns to, I'll just mention with feedback that we've heard from our peers who are on the 2727, that's in reference to a can't remember if it was a House or a Senate bill, but the work group that is working on barriers in childcare, this also came up there. So it is definitely something that we heard loud and clear in multiple arenas.
Yep. Yeah. Great. So I am, oh, Floor?
Just a quick question. So if the limit of an in-home certified numbers is 16, why leave it at 15?
Why, I'm sorry.
Oh,
Yeah,
I think
so the maximum amount of children that we can have under our care is 16, right? So the
Yeah.
rule says if there are more than 15 children, couldn't you just put it to 16? I mean, it's one more kid. What difference is it gonna make?
It is. We're going to rule will state that basically there just needs to be one toilet
One toilet.
and one hand washing sink
Yes.
for the entire home.
Yeah.
Yeah.
Because it just didn't make sense to have to require 2 toilets for one child. It just, yeah. So that's what we're proposing.
And there's just one question or something in the chat that says, Danny says some of these rules are funny. More than 12 toddlers need another toilet. I assume that was intended for toilet training. I was not here for the adoption of these rules, but I would guess that's it.
Yes.
Also, we did a lot of looking around at other agency rules to see where even 15 came from. Like we were wondering where 15 children for one toilet came from. And really there wasn't a lot to cite to for that. And especially since it's one additional child. And then Tina says, just want to point out there, it would be helpful if there was help to navigate the move from RF to CF. So more supports in moving from one type of care to another. Tina, that's a great call out too.
Yes, definitely. Okay, I'm gonna move us forward for the sake of time here. So I want to touch on indoor environment and temperatures. So in the current rules, certified home and RF home, they don't read they don't read similarly. So in certified family, it says the room temperature shall be at least 68 degrees Fahrenheit and not so warm as to be dangerous or unhealthy to children in care. RF says the room temperature must be at least 68 degrees during the hours the childcare business is conducted. So our proposed change is to make them read the same. So a certified or registered provider or childcare must have adequate heating and ventilation to maintain the indoor temperature no lower than 68 degrees and no higher than 85 degrees when children are present. If the provider is unable to maintain an internal temperature between 68 and 85, a provider must utilize strategies to help children stay warm or cool. So this proposed change will help provide some flexibility for those times when the temperature may dip below 68 degrees on the thermostat, but it isn't too cold for children to be in care. And the same is true for the upper range of temperatures. And the strategies, we said strategies because that allows for some flexibility dependent on the situation and your home and the resources you have available at hand. So Kelly, it looks like you have your hand up.
I was just curious where the 68 degree came in at, like who made that decision on that one? I was just curious. Any idea?
You know, that is a good question. Abby, you may know.
I'll have to look it up. I believe it's Caring for Our Children. But I will say that the upper limit of 80, 85 is not from Caring for Our Children. That's actually higher than what Caring for Our Children recommends. But we also, this aligns with what's in Certified Center, I will say that. And when these rules were developed, it was very difficult for folks to keep temperatures below what would be the recommendation from Caring for Our Children. So, but I will double check that, but I believe it is Caring for Our Children.
Okay, I was just curious.
Yeah, that was a good question. Yes, Annalise.
So the first part of that rule, a provider would be in full compliance as long as they had adequate heating and ventilation. Or does that say adequate heating and ventilation? Heating and ventilation is adequate if it can maintain the indoor temperature no lower than 68 degrees and no higher than 85%, which is the correct interpretation.
But
And maybe that's something you don't want to answer right now.
If it goes lower or higher, you just have to utilize strategies in order to help children stay cool or warm.
I mean, because that there is some ambiguity there, and I can see how provider could be cited under one part of the rule but not the other, and I think that creates, maybe that creates a problem. So and then I just also want to just raise that current SIDS standards nationally and internationally say that infants should sleep in a room that's cooler than 68 degrees. But
that's good feedback. Thank you. Abby, is there anything else in the chat?
I'll just, and Anna has her hand up, but also 68 does come from Caring for Our Children. And then, but they're very specific. They talk about draft-free temperatures, and there are a lot of additional considerations in Caring for Our Children as well. And their maximum or recommended maximum is 75 degrees Fahrenheit with certain levels of relative humidity.
Yeah. Annalise, is that an old hand or a new hand? Okay. Anna?
I just want to follow up on what Annalise was saying. I also think that, unless you've been in a room with 16 people and, 2 or more adults, 68 degrees can feel very warm when everyone is moving around and doing things, especially for myself, my home. One of our classrooms is in my basement, and I had to have a separate heater installed in there that basically has to run all winter because it is impossible to keep that room at 68 degrees otherwise, just because the rest of my home would have to be, like 75 degrees probably to keep that room at that temperature. So that has obviously been a constant problem and something that we've had to, deal with all the years that I've been licensed, even though the kids would never complain about it being cold. 65 degrees would probably be more than adequate for most of them if they're in that room, especially when they're under blankets sleeping and things of that nature. So I think that could obviously be looked at. I also want to caution or again make the recommendation that some type of technical assistance is provided about what are strategies that could be used, especially for people being too warm. I admin a family childcare group of 600 or so people, and we get a lot of questions every single summer about, are people closing because it's going to be 100 degrees? What are people doing that don't have air conditioning? And as climate change becomes more and more prevalent and our summers become hotter and hotter, especially as our winters get colder and colder, having these types of limitations on programs are going to create more and more barriers for people.
Right. That's really good feedback, Anna. And I think, identifying some from you folks, like what would be beneficial in terms of a technical assistance document, a rule guidance document, is helpful for us to take forward. Annalise?
I just would like to just add one last point on this issue. you know, my experience is that I often have air conditioning when others don't. And parents will come in and say that if I got it down at 60, if the room's only like 67 degrees, that it feel, and 67 and 68 isn't a huge difference, but they'll come in and say that how great it feels inside. And the same in the wintertime if I keep things a little bit warmer. So part of that is, and I think we need to recognize this, that if a provider does not have a cooling source that's going to keep the inside temperature at under 85 degrees, I would argue that probably most of the daycare children also live in a home that is going to be warmer than 85 degrees. Now, I don't know about 68 degrees and if it's going to be colder or not, but I think it's sometimes on the parent to make a decision if they believe their daycare is going to be too hot or too cold. It should be on that parent to make a decision about whether or not they're going to keep that child home, because if a provider isn't, again, if they're not able to, right, and they don't really have much strategy at their disposal because they don't have an air conditioner and that fan is just pushing around 95-degree air. I just don't want to see a situation where a provider is cited a valid finding for something that is completely and totally beyond their control.
That's a good point, Annalise. Thank you. And Anna, and then we've got to move forward. So
Yeah, I just want to piggyback on that, and then what Heidi said in the chat, that it does create kind of a very inequitable and a classist type of a situation when we have these types of things, because parents might be less inclined to want their children to go somewhere that doesn't have air conditioning or doesn't have some of these things that everybody's not going to have. All homes obviously do not have central air conditioning in Oregon. That is not the norm, and it's very expensive to install. So we don't want programs that only maybe have a portable AC or only have fans, to be looked down upon by parents and families, or heavily criticized by parents because they can't keep it under 85 degrees. And I have seen those types of things happen to providers from parents in the past.
Okay, thank you. Abby, and then we've got to move forward.
So Danny says 68 seems high for a low. Heidi agrees and says that 68 seems very, very hot. And it's hovering around classism to demand air conditioning, and that Heidi also agrees with Annalise.
Great. So for our last conversation topic here, it's dealing with screen time. So in certified home, we have that no child may view television or videos or play computer or electronic games for more than 2 hours per day. And in registered home, we have that childcare children shall not be exposed to more than 2 hours of screen time per day, and all media exposure must be developmentally and age appropriate. So we are looking at ensuring that the rules for both certified and registered read the same. And the proposed rule is that childcare must not allow a child to have more than 5 hours of screen time per week. We're going to define screen time as time spent using electronic devices such as computers, television, tablets, phones, and game console. This does not include assistive or adaptive technology for children with disabilities. We're also proposing to allow for time to be extended for special events, projects, or homework. So that could be like movie time, things like that. And it must be developmentally appropriate, nonviolent, and culturally sensitive. So the rationale for this change comes from Caring for Our Children, and it recommends that screen time or digital media not be used with children ages 2 and younger in early care and education settings. And for children 2 to 5, a total exposure, and when they say total exposure, they mean in childcare and at home combined, to digital media should be limited to 1 hour per day. And then they go up and they increase the time and explain that older children may need to use digital media for homework or completing projects. But for children of all ages, the digital media and devices should not be used during meal or snack time or during rest, nap or rest. And as I mentioned, the one important thing to remember is that the guidance above does not limit digital media use for children with special healthcare needs or who need assisted or adaptive computer technology. But the same guidelines do apply for entertainment or media use. So thoughts on the screen time proposal? Yes, Anna.
I think this is going to put registered family programs that have school age kids potentially in a pickle, especially during summertime. Imagine you're the one adult and you potentially have 2 school age kids and you need them to be quiet for a 2 to 3 hour period so that the other kids can sleep, so that you can do dishes, maybe so you can do other things that need to be done. And keeping those children quiet and occupied, especially depending upon the layout of your home, could be very challenging if they are only allowed to have 1 hour of screen time. Especially if other times registered family may put on a 20-minute program for the whole group so that they are able to step away and go make lunch for those children without anything happening. And then again, now you only have 40 minutes for those school age kids to potentially be quiet and occupied while you do something else. So I think that will be very, very challenging for programs with school agers. And I would recommend maybe having a separate limit for school age children versus children 5 and under.
Okay, good point. Thanks, Anna. Yes, Abby.
Tina says, I do not think it should include home use. And Tina, I'll just say that it does not. We can't, we don't expect you to try to calculate how much children maybe what or screen time children may have at home. I think Carol, you were just speaking to the justification for or the rationale from caring for our children. So, and we recognize that we cannot control, of course, or expect you to control what children and their parents do in their own time in their own home. And Carmen says that I agree with Tina. And yep, okay.
Okay, great. And Kelly, does Kelly, you have your hand up?
Yeah, I think dividing the school agers apart is a wise choice.
Okay.
Because when I was registered, that it was just me, and that's a huge, huge thing. The older kids should be allowed a little bit more. I don't know what all the statistics or the research says. You know, the younger kids shouldn't have more than such and such, and the older kids, I think, are allowed a little bit more time. So I really think you need to divide those somehow so that it's fair for providers. Because I remember those days, and it was tough when I didn't have staff. It was hard.
Yeah, that's a great point, Kelly. Thank you. Annalise.
I think we also need to call out the rule about cultural appropriate care, whatever the rule says. That we're providing care that reflects that parent's culture. Because if you have a child, and there's a huge difference between a 2 or 3 year old and a child who's like 7, 8, 9, 10, 11, 12, who in this day and age is very likely to have a tablet or a cell phone or even a watch where they are they're texting back and forth with their parents. They're allowed to text friends. They're allowed to communicate with friends. So I think that screen time, in my experience, could add up very quickly for those older children. And it's just a cultural adjustment that I think we're going to have to make, recognizing that phones and other telecommunications devices have become pretty important to kids. I've had kids in my program in the past whose parents paid a lot of money for them to use or access games, educational games and whatnot on their tablet that would be entertainment and educational, but probably more entertainment than educational.
Mhm.
And so I think, we just have to be careful about the messages that we're sending to parents, the impossibility of possibly some of those messages. And I understand that a provider can say, well, it's the Department of Early Learning and Care's fault. They passed this stupid rule and I got to live with it. We can put it off on all of you. But here's the thing. If it creates such a problem because of cultural divide, and then parents feel like they don't have options, they can't put their children in childcare. And let's face it, unregulated providers will become the new norm for these children. And that's not necessarily always a good thing. So I think we just need to be careful about,
Okay.
It's 2024 and things are different.
That's a great point. Thanks, Annalise. Abby, and then we'll need to wrap up in order to end.
Yep. Gabby says, I agree with you, Annalise. My school age kiddos all have phones, and I understand why my own kiddo, she is to keep hers on her at all times when we are separated. And Tina says that is part of the problem, is that we're giving in and not setting boundaries. And thanks so much for your information. Okay.
Okay. So next steps, we're gonna review the comments and suggestions that we received today. We're gonna work on proposing some rule language and incorporating the suggestions when possible. The draft rules will be available for public comment starting in September and will run approximately 6 weeks. And we are going to be recruiting for a RAC, or a Rule Advisory Committee. That recruitment's going to begin in August, and the RAC will take place in mid-September through the beginning of October. And that will go ahead and review all of all rules, more than just the topics that we've discussed. So I want to thank you again for all your feedback you provided to us. You provided us a ton of information, and I know you guys have worked all day, and so we truly appreciate the feedback and the great thinking that you brought forward, when I'm sure you guys have really put your time in and you're ready to just relax a little bit. As mentioned in the first meeting, you're going to be reimbursed for your time. Please watch your email for reimbursement instructions, and know that the email most likely will not come from me, but it will clearly indicate that it's pertaining to the reimbursement process. And just as a heads up, the process does take a little while because we have multiple units within DELC that work on this. So please be patient. And then one other thing is, if you have any additional input or thoughts that you would like to provide pertaining to the discussion topics we had tonight, you can please feel free to email me at the email address on this slide, and that will be added into the meeting notes. And it looks like, Soshi, do you have? Oh, maybe it was an accidental hand raise. Okay. Anything, Abby?
There are a couple things, thank yous in the chat, and I just wanted to say that Danny is making a suggestion that maybe a requirement to develop a responsible use of screen time and limits policy. It might be more reflective of the times that we're living in now. And that boundaries are important, but it's also important to be responding to family culture and balancing both things with what is best for the child. But that's it. All right.
Okay. Well, thank you all.